In this video, I will illustrate the complexity of digital health and wellness. I will concentrate on the following points: time spent using technology, internet addiction, eye strain, and making sure media content is safe and appropriate for children and teens. Is there such thing as too much internet browsing or too much online gaming? We live in a world where we are surrounded by digital technology: iPads, laptops, desktops, smartphones, and even smart refrigerators. Sometimes technology and going on the internet can become an addiction. We can become physically and psychologically ill from the overuse of digital technology. According to the Vision Council, on average, nearly 9 in 10 adults, or about 88%, spend more than 2 hours each day using a digital device, with 1 in 10 people spending at least 3/4 of their waking hours on a digital device. Technology is taking over, but we have to understand that it is not normal for our eyes to constantly focus on small screens for several hours out of the day. We need to take breaks and let our eyes and body rest. Constant usage of technology is causing symptoms such as eye strain, dry eyes, blurred vision, and carpal tunnel syndrome, headaches, and more. If you are constantly holding your cell phone while laying down, you will eventually have symptoms of arm, neck, and back pains. There are several steps we can take to improve our digital health and wellness. We live in a society where we are constantly updating Twitter, Snapchat, or Facebook with the latest news on what we are up to. Sometimes it is best to actually enjoy what you are doing instead of making sure everyone else is up to date with your daily life. The most obvious solution is disconnecting or taking a short break from technology and taking some time to enjoy activities such as hiking, biking, going to the mall with friends, and spending time with family. A relatively new problem we have is internet addiction. There are people who are addicted to online gaming, Facebooking, and more. So what are the symptoms and how can an individual with an internet addiction be treated? According to David Greenfield, those who are considered internet addicts spend anywhere from between 40 to 80 hours per week online. They would rather stay up surfing the web instead of sleeping at night. It is difficult to detect internet addiction because in our society, the workplace, schools, and social media require us to get on the internet quite often. In other words, the internet is so popular that it is difficult to distinguish addiction over normal usage of internet. Kimberly Young developed the Internet Addiction Diagnostic Questionnaire, which is used as a tool to screen patients for internet addictions. If a patient answers yes to 5 or more questions over a 6-month period, then they are diagnosed with internet addiction. There are a couple different treatments for internet addiction. There's cognitive behavioral therapy, which is a 3 to 4 month long treatment that can be used as a treatment for internet addiction. Another treatment for internet addiction is controlling your internet usage and time. Young believes that daily logging, how often the patient uses the internet, can help with the clinical treatment. Overall, an internet addiction can slowly be treated by admitting to having a problem and learning to take control of internet usage time. So what can we do to avoid digital eye strain? You can start by talking to your optometrist. According to the Vision Council, 90% of patients do not talk with their eye care provider about digital device usage. In this day and age, it is very important to mention digital device usage to your optometrist because technology is everywhere. There are computer glasses that can help relax your eyes, reduce blurriness, and pixelation. You can get computer glasses with or without prescription. Lastly, limiting time on the computer and taking short breaks can help avoid eye strain. What about children? We should limit media usage or screen time. I'm sure we have all seen parents using smartphones or tablets as a pacifier. Bye-bye pacifiers. Hello smartphones. Is it a good idea? Well, some screen time can be good for children, but too much of anything is bad for you. It is best to play and read with children under the age of 2. The American Academy of Pediatrics advises parents to avoid allowing media usage for children under the age of 2. As for children older than 2 years of age, they should be limited to less than 2 hours of screen time a day. Parents should also make sure the children are watching age-appropriate content. There are applications such as YouTube Kids that are designed to only allow content that is safe and age-appropriate. There are also parental control applications that allow children and teens to only have access to certain applications on a smartphone. An example is KidTroll, which allows parents to remotely control their child's phone by disabling certain applications such as Snapchat, Instagram, Facebook, and Viber. So in conclusion, we must learn to limit our technology use appropriately while at the same time taking breaks in between technology use. Internet addiction must be taken seriously because it is just as serious as any other addiction out there. The patient needs to focus on recovering so that they can get back to living a normal life. Eye strain and many other health concerns can uprise if we are not careful with how we take care of our bodies during technology use. Lastly, parents must always check digital devices for child-safe content while at the same time limiting usage time. My intention was to get my audience to understand that technology should be used cautiously, and it should now be clear that digital health and wellness are important as our everyday lives are filled with digital technology. Thank you for watching.